So esophageal cancer is one of those cancers we never want for anybody. It's one of those things we try to minimize or at least make sure our patients don't get this. Unfortunately, patients end up having this. So the biggest risk factor when it comes to esophageal cancer is what's called Barrett's esophagus. And the biggest risk factor when it comes to Barrett's esophagus is chronic acid reflux. And so our goal is to make sure we can screen patients who are at risk of developing Barrett's esophagus to make sure they don't develop esophageal cancer. What are those patients? They typically are middle-aged, obese Caucasian men with long-standing acid reflux. And it doesn't even have to be reflux that's really intense, that's severe. It's the length of reflux that can trigger the risk factors for this. So in this case, unfortunately, we did have that exact same patient. I had a 55-year-old man with long-standing acid reflux who came to see me with trouble swallowing. Now, dysphagia or trouble swallowing can be due to so many different reasons. It can be chronic acid reflux developing a stricture or a narrowing to occur. It could be eosinophilic esophagitis or EOE, in which you have an allergic response to the body that causes a narrowing to occur. One of the most feared things we worry about is esophageal cancer, and this is the case. So in this video here, you can see a mass. Unfortunately, there's a little bit of food there, but you can see a mass that's obstructing the esophagus, causing the cancer to occur. And this is why this individual is developing trouble swallowing. And this mass ended up being esophageal cancer, specifically esophageal adenocarcinoma. So esophageal adenocarcinoma is the risk factor from Barrett's esophagus. Chronic Barrett's esophagus will lead to changes in the cells of the esophagus. So normally in our esophagus, we have what are called squamous cells, which are normal cells. As those cells become more irritated from chronic acid reflux, it develops into what are called columnar cells, which are the same cells in your stomach. Remember, your stomach can control acid. It can have it. It's not a big deal. But as that progression continues, the esophagus doesn't know when to stop. And so it continues mutating, going from squamous cells to columnar cells to dysplasia to low-grade dysplasia, high-grade dysplasia, then eventually esophageal adenocarcinoma. And this is a sequence from GERD to Barrett's to esophageal cancer. Now, this in case, unfortunately, this individual ended up having esophageal cancer. He actually ended up having stage 3 cancer, and unfortunately, he did not survive long after this. And this is the problem when it comes to esophageal cancer, is that by the time you've had symptoms and diagnosis, it may end up being too late, meaning there may be already progression, and it's hard for us to treat that in that setting. And so our goal as doctors is to screen those individuals that are higher risk, make sure they don't have the complications, and get them taken care of. And we want to make sure that if you have patients or if you're one of those that are risk factors, come see someone like me. We can find out what's going on and get you taken care of.